Hi everyone, good morning, good afternoon, good evening, depending on when you're watching this video. This is Chapter 11, Video 2. Please, if you have not watched Video 1, Introduction, please go back and do that. It's vitally important that you do that before you watch this one, okay? And please make sure you watch all the videos in order. Okay, to get started, we are starting Chapter 11, which is Capillary Blood Specimens, and it starts on page 371 in your textbook, okay? Which, if you look in your textbook, you have learning objectives there. I'm not going to read every one to them. You guys are capable of reading. But we're going to talk about the reasons why you would do a capillary blood specimen. We're going to talk about the differences between the makeup of the blood that comes from your capillaries versus your veins versus your arteries. We're going to talk about tests that you can do with capillary specimens and tests that you can't do with a capillary specimen, or that's not advised for you to do with a capillary specimen. We're going to talk about proper sites for the procedures. We're going to talk about control of your depth and why that's important. And we'll go through both making blood smears and performing skin punctures, okay? So, we're going to start off with indications for skin punctures. You know, why would we do this, you know? And, like I said, read your chapter. In the intro, I talked about that because it goes through a lot of reasons why you would want to do this. First and foremost, it diminishes the likelihood of either causing anemia or making someone's anemia worse, right? It decreases the risk of an accidental Sharp's injury if you do your skin puncture correctly, which you know, guys, how I tell you in lab, never hold your patient's hand in yours when you're performing a skin puncture. It also reduces the risk of injury in adult patients like nerve damage because it's less invasive. It reduces the risk of injuries and complications for children and infants, things like anemia, cardiac arrest, things of that nature. Also, sometimes when you're doing venipuncture, you have to restrain a child during that procedure, and you can have injuries from there. It's less likely to have to restrain a child when you're doing a skin puncture, okay? So it's cost effective. The equipment costs less. The supplies cost less. It's a faster procedure than collecting from a venipuncture. And it makes self-monitoring much easier. It's a big game changer for diabetic patients who can do their own skin punctures themselves at home, monitor their blood sugar levels throughout the day to make sure that they're getting their correct medicine, watch their diet, their insulin intake if they're insulin dependent. Okay, so we're also going to talk about the fact that people perceive it as less painful. And that does make a difference in some situations. So those are things you want to look at. So it's also crucial to collect only small amount of bloods needed for laboratory tests for any patient. Okay, we don't want to collect more than what we have to. And as everyone knows, if you've been in the hospital before, we go in and out of your room a lot collecting blood. So we want to be very careful. So we only want to collect the smallest amount that we need for our procedures. And that's never more important than it is when you're talking about neonates, infants, and children, okay? So other things that may require you to do a skin puncture, and you see the list up here: severe burns on the arms, obesity, saving veins for IV therapies for oncology patients, and all the rest that are on there. We talked about point of testing and how much of a game changer that is. So then, there's with everything we're going to talk about today, you know, there's tests you can do and there's tests you can't do. There's times when you want to use skin puncture, as we just talked about, and then there's, of course, times you do not want to use it. And here's a list of a few things. There's more in your textbook, okay? But when testing may require large amounts of blood, if their fingers are swollen, has a lot of interstitial fluid there between the tissue, that can dilute the blood and give you erroneous results. The patient could be dehydrated, and therefore skin puncture is less likely to produce blood drops. The patient may have poor peripheral circulation. That's circulation near the surface of the body. So also, what about tests? There's tests out there that are not recommended for skin puncture, like ammonia, blood cultures, coagulation studies, although you might see some PTs done by finger stick. It's very unlikely, but it does happen. And there's a little study tip down there, because these are one of those lists of tests that you are going to need to memorize, because there are situations where you want to be able to take this information and use it in the field. So that A, B, C, C, D, E is a good study tip for memorizing those. Okay, this is our first case study. A 55-year-old female was admitted to Ochsner's Hospital. The physician ordered a CBC and blood cultures. It's very important that we see on our rec what our doctor ordered and get that in our mind, okay, so we can make the correct decisions based off what this doctor ordered. How should the blood be drawn, by skin puncture or venipuncture? Now, this is a time, and I'm not going to say this going forward, but this is a time, and I talked about this in the introduction video, that you can pause this. Get you a piece of paper out, and all of these case studies, pause it right here quickly, and go ahead and make your determination, and that way when I move forward with the slide to show the answer, you'll see if you are getting the correct answer. Okay, so the blood must be drawn by venipuncture because blood cultures cannot be done by skin puncture. That's why it's important that you understand which tests can and cannot be done by skin puncture. If the doctor ordered a CBC, chemistry profile, and ammonia test, how should the blood be drawn? The blood must be drawn by venipuncture because the ammonia cannot be done by skin puncture. And then in what color top tubes using the least amount of blood, because least amount of tubes, which would be the least amount of blood, and that's what we always want to do, would be best, and what color top tubes should be drawn, and what order should they be drawn. These are all ways that you use the things that you learn in lecture and lab to do critical thinking and be able to put these tools to use out in the field when you're working as a phlebotomist. So you would do a green and then a purple, because obviously the green can be used for our chemistry stuff, right? And then the purple for our CBC. Okay, talking about the composition of capillary blood. This is one of those things, and you'll see it noted down at the bottom, always to be noted on the requisition, if it is a skin puncture, if this blood was collected from a skin puncture, because the composition of capillary blood is different than venous blood. It is much more like arterial blood. Because of that arterial pressure, it pushes and it gets more of the arterial blood into the capillary than the venous, so that's the makeup. And it's very important because things like potassium, total protein, and calcium have lower values, and you have higher values in the glucose than in the venous blood. So we want to make sure we note that on the requisition so our physician will know. Our next case study, hope you have that piece of paper out, okay? A 4-year-old male was admitted to Willis Knighton South. The physician ordered a CBC and chemistry profile. The phlebotomist should not get blood from the child by venipuncture because the kicking and movement of the child made it unsafe, so they weren't able to stick them by venipuncture. So they decided to draw the blood by skin puncture. Is it acceptable to draw blood for these tests by skin puncture? So you got a CBC and chemistry profile. Yes, both of these tests will give accurate results if drawn by skin puncture. What other step should they take when drawing the blood by skin puncture? Noted on the requisition form, right? So that the doctor will be aware that this is capillary blood. So moving on to talking about our skin puncture sites and what's best, and we've talked about this in class and in lab before. We use that third and fourth finger, okay, of your hand, right? And down at the fingertip, slightly off center, right? Because we don't want to go directly in the center because we run the risk of hitting a bone, okay? And we don't want to do that. Also, the very center tip of your finger, because we touch things and do things from entering things on a keyboard, it makes for the fingers to be callous, which would be a little harder for the lancet to get through there, which would mean you might not get a really good stick, which would mean you might not be able to collect the amount of blood that you need, okay? And you guys had started doing finger sticks in lab, and you see how hard it is to get a good stick and be able to collect the blood that you need. Also, if they're less than a year old, they're not walking, we can stick the lateral or medial plantar surface of the heel. Okay, so make sure you read through these. Okay, so then we also have sites that are not recommended for skin puncture. And if you'll notice in your textbook on page 379, there's a really good photo that kind of shows you exactly where you want to stick your patient on their finger. Okay, so make sure you're checking that textbook as well. So sites that are listed up here, you see them: the earlobe, all the way down to the thumb, the pinky finger. We do not want to stick any of these in an infant less than a year old because their fingers are a lot smaller, and we don't want to hit a bone. Okay, so and on page 380 in your textbook, there's a lot of really good information on there. So make sure you check that out. So our next case study: a 57-year-old woman with breast cancer was admitted to Ochsner's Hospital. 1 year ago, she had a mastectomy of her left breast. She had an IV in the right dorsal hand. So we need to note that blood should never be drawn from above an IV. So the doctor ordered a CBC and a glucose test. How should the blood be collected? It could be collected by skin puncture in the third or fourth finger of the right hand, right? Because the mastectomy is on the left side of her body, so we wouldn't want to use that left arm or left hand. We don't draw above an IV, so if the IV's in her hand, the fingers are below that, so we could collect it on that third or fourth finger of the right hand. Okay, in what color top tubes should the blood best be collected, and in what order? Purple, then gray would be best. Okay, because we're collecting a CBC, which is for the lavender or purple top tube, and then a glucose on its own, the gray top is the best tube for just a glucose. So also, improving site selection, we always want to make our job as easy on us as humanly possible, as easy on the patient as humanly possible. So things like warming the puncture site, okay, helps facilitate phlebotomy by significantly increasing arterial blood flow to the area. Capillary specimens from warm sites can be described as arterialized capillary blood. Okay, and there's several easy-to-use methods of warming. There's commercially available thermal packs or heel warmers that you can use. You can get a surgical towel. There's lots of things you can do, and you want to place it on there for 3 to 5 minutes so that that skin temperature can increase. Okay. Also, lowering the arm will help increase that blood flow to your fingers, which would help you make sure that you get a really good stick. Okay. We don't want to have to stick them again, and we want to make sure the sample we collect is the best sample we can get so that we can get the best results we can get. So our next case study, you come to collect blood from a 5-year-old child at a physician's office. The doctor ordered a chemistry profile and a CBC with differential. You decide to do a finger stick. You feel the child's hands and they are cold. What should you do and why? Okay, we want to warm the child's hand for about 3 to 5 minutes to increase the blood flow by 7 times. Why? That's why. So in what collection container should the blood be drawn? We're looking at a chemistry profile and a CBC with differential. 2 blood slides, because we always make our smears first. We always make our blood smears first, and we need that for the differential. Then we need a purple micro container for the rest of the CBC and a green micro container for the chemistry profile. And remember, we talked about the differences in how they're collected and in what order they're collected in venous samples versus capillary samples, okay, because they're backwards. Okay, so going on to cleansing the puncture site. And remember, like I said on page 380 in your textbook, it talks about cleansing the skin puncture. Okay? And we know that we're going to use that alcohol pad that contains 70% isopropyl alcohol. Okay? We're going to clean it with concentric circles, and we're going to allow it to dry. And you see up here problems that occur when you don't allow it to dry. We've talked about this many times, from hemolysis to glucose determinations being contaminated. It prevents the formation of a good round drop, which is going to really impede your ability to collect these specimens. And plus, when that alcohol does not dry, you did not give it the time it needed to do its job, which is to clean the skin. And we all now are seeing with this COVID-19 outbreak how vitally important hand washing is. And every day, it shouldn't take something like this for us all to realize that we need to be routinely washing our hands, and the spread of infection can have horrible consequences, and how important using your proper PPE and how to wear your PPE properly is vitally important. So, as you see down here, it also talks about how iodine or betadine is not recommended for disinfection of skin puncture sites because it can falsely elevate the potassium, the phosphorus, and the uric acid. And that little study tip down there is stinky iodine. Everybody knows iodine has that little weird smell to it. PPU. And that will help you in memorizing some of these listings. Okay, another little think question. This is you taking the information you have learned and using it to think through scenarios. So why should you not blow or fan the arm or finger to get the alcohol to dry faster? So we know this, right? And we're learning the importance of not spreading germs and how detrimental that can be. Okay, so one reason to let the alcohol dry is because failure to let it dry prevents the formation of rounded drops of blood. Why is it important to have a big, hanging, rounded drop of blood on the end of the finger? Because if that blood flattens out on the finger because it's wet from the alcohol, it's going to run all around, and there's no way you're going to be able to either touch that capillary tube to that big drop of blood and have it suck in there due to capillary attraction, or be able to touch it to the scoop and have it go down into your micro container. And as y'all were learning in lab, doing that is very difficult if you don't have that big rounded drop. So you need to do a skin puncture for an electrolyte profile, and you ran out of alcohol pads. You are on the 12th floor of the hospital. Can you go ahead and use iodine to clean the skin? Why? No, because iodine will falsely elevate potassium values in the electrolyte panel. So moving on, okay, we're going to be talking about acquiring a capillary blood specimen using the retractable safety device. Okay? So some things to remember, as we just talked about, you want to decontaminate that site, right? All right, and so if you look in your textbook on pages 382 and 383, it goes through this entire procedure, including photographs. And so the thing I want to touch on, y'all, is the one with the exclamation points by it, is these are the things important. First, you always wipe away that first drop of blood. You always remember that blood smears should be made first, and you always have to remember, once you've collected your blood in your micro container, you want to invert it gently 20 times to mix that blood with whatever additive happens to be in that tube. Remember, if you shake it, that is one of those things too vigorously that can cause hemolysis. And remember, when filling a capillary tube, blood flows into that tube by capillary action or capillary attraction. You remember me talking about that, okay? And then you always want to try to, you don't want to scrape that scoop across the finger. You just want to kind of touch it to that big drop, rounded drop of blood, and it will, by that capillary action or attraction, it will go down into that container. So you want to make sure that your hand is in a downward angle. It helps that blood flow down into the finger so that you'll get good blood flow, okay? and you want to don't do a lot of milking or massaging of the finger. We went over this in lab, or forcefully scooping of the blood, because it could get more tissue fluid in there, which could dilute your specimen and give you erroneous results, or it could cause hemolysis. And as always, we always want to follow our manufacturer's instructions on how to properly fill any type of collection container, on using any type of device whatsoever. We always want to read that and make sure we're informed and educated on these items before we start using them. Okay, we also talked about this in lab, that we don't want any air bubbles to enter our tube when we're collecting capillary tubes. We talked about wicking that blood out and getting that blood back down to the end, and then continuing to collect our blood as a way to get rid of those air drops, those air bubbles in there. And we also want to ensure that bleeding has stopped before we apply our bandage. And also remember, this is important, the average depth of skin puncture should be 2 to 3 millimeters for adults and less than 2 millimeters for small children and infants, to avoid injuring that bone, okay? And again, on page 385, there's some really good stuff on capillary blood specimens collection. And at the bottom of page 384, you see a lot of different devices for blood collection, and it goes into a lot of really good information on that too. Okay, now talking about acquiring a capillary blood specimen, we want to talk about the repeated puncture to that area can lead to osteomyelitis. That's what we talked about, not sticking in the center of the finger, being off-center, and not sticking right on top of another stick in the exact same spot, because we don't want to lead to that. Also, we want to talk about labeling our specimen immediately. You know, there's a few things, IDing your patient properly is the most important thing. So you want to make sure that you ID them, but then you also may want to make sure you label your specimens properly. And remember, we never label anything before we collect the blood, but then the minute we have our blood collected, we immediately label our specimens, okay? We also, we talked about once we collect our capillary tube, that we put our finger on one end of it like we do a straw, and then you put it down into the clay to seal it, you rotate a little bit, twist it out, right? And remember that those blood smears are always made first, and the EDTA specimens are for hematology, okay? And the order of draw, like I talked about earlier, is opposite of venous. You do the EDTA specimens for hematology first, after you make any smears if you need to, then other tubes with additives, and then non-additive tubes like the red tubes. So our case study, you have to draw blood for a strep test, a cholesterol, and a CBC with a manual differential from a finger stick. How would you collect the blood? Okay, first make 2 blood smears from the manual differential, then collect a purple top microcontainer for the CBC and a red top or SST microcontainer for the strep test and cholesterol. How many times would you invert the microcontainers? 20 times. Okay, so talking about microhematocrit and hematology specimens. Okay, the microhematocrit, also known as packed cell volume or PCV, can be collected directly into a capillary tube containing heparin, okay, that should be filled 2/3 of the way full and sealed at the end with a sealant or a cover, because we don't want that blood to come out. Okay, we don't use heparin for collecting our hematology specimens that we're going to do any type of cell morphology on, because heparin distorts that cell morphology when we're staining the slides. So we don't use it for that. Only for the microhematocrit tubes. So we're going to talk about this. This is a procedure for making our blood smear. And you'll see down there, also, if you'll look on page 387 in your textbook, and it talks about this on that page and the next page, and it goes through every one of these procedures and shows you how to make your blood smears. So make sure you check that out, okay? On those pages, like I said, from 387 all the way over to 389 in your textbook. But as you can see, you put that drop of blood down near your frosted end where you label your slide. You put your spreader slide in front of the drop of blood. You gently bring it back into the drop of blood. You want to have it at about a 30 to 35 degree angle, okay? And then as you see that blood starts to quickly, as it touches the spreader side, it's going to run across there. Then you don't press down hard, you just go forward with your slide, okay? So if the smear is too short, then you make the angle smaller, okay? If the smear is too long and it's going straight off the end of the slide and you don't have a nice feathered edge down there, because it only should fill up about half of that slide, then you want to make your angle larger, okay? So remember, these are the procedures. Don't blow on it or anything like that. You just want to let them air dry once you've made your smears. And remember, you want to have that good feathered edge on the end. It fills up about half of the slide. It needs to be smooth with no ridges, lines, or holes. And you want it to go from a thick to thin margin. But look at those pages in your textbook as well. Okay, now talking about blood pH and blood gas determinations. We can do these on children, okay? And so what you do is you take the special capillary-like blood collection system, and this is done on children. You draw your blood into there. Then you have a mixing flea, which is a tiny steel wire device that you slide into the tube, and then it's sealed. And then you take a magnet and you move that flea back and forth inside that tube of blood to mix the blood with the anticoagulant, okay? Now, we want to worry about hemolysis on capillary blood, okay? Because that can cause some erroneous lab results, and we don't want that, okay? So a phlebotomist can cause hemolysis by these things. We've got to let that alcohol dry. We don't want to milk that finger excessively. And you don't want to mix that specimen vigorously. You want to invert it 20 times gently. So there's two types of hemolysis, okay? There's in vitro and in vivo, okay? So now, when you name some types of each, I want y'all to think this through and look into it. So there's in vivo, which is snake bites. If you've had heart valve replacements and they're metal now, transfusion reactions, those are all things that inside your body can chew up your cells and cause hemolysis. Then in vitro is something that happens outside the body, which is the stuff that the phlebotomist that you see listed on here that you can read does that can cause hemolysis, okay? So make sure you know the difference, okay? So in summary, we talked about how much blood can be safely drawn from infants, when skin puncture should and should not be used, the difference in the composition of skin punctured blood from venous blood, and blood smears, and how to perform skin puncture. So like I said, watch these videos in order. You can pause them, rewind them, start filling out your study guides, and read your chapters. And look, I will have these posted soon. You guys have a great day. Email me with any questions, and I hope to see your pretty faces soon. Thanks a lot. Have a great day.